We've all heard that we should be drinking 8 glasses of water a day, but do you know why? Water constitutes approximately 60% of an adult's body weight and is the cornerstone of every physiological process, from cellular metabolism to temperature regulation. Yet in busy modern life, many of us remain chronically underhydrated. You may think that you're doing okay because you have no obvious symptoms, but did you know that even mild dehydration can impair your mood, energy levels, and overall performance? Have you noticed signs of mild dehydration such as dry lips, fatigue, or dark yellow urine? Are you confident that you're drinking enough water throughout the day? You might be surprised to learn that most people aren't, and chronically low hydration levels are more common than you might think. Drinking sufficient quantities of water daily is essential to maintaining health and preventing disease. But how much water do you need? Unfortunately, there's no one-size-fits-all answer to this question. A number of factors influence our daily requirements, including body size, physical activity levels, diet, and climate. In general, however, experts agree that most adults should aim to consume between 2 and 3 liters of water per day. That's about 8 to 12 glasses. But why do we need so much water? Our bodies are like intricate machines with millions of moving parts, and all of those parts need water to work properly. When we're dehydrated, even by just a small amount, it can cause problems throughout our body. For example, our brains are about 80% water. When we don't have enough of it, our brains can shrink slightly, which can cause headaches. Dehydration can also make us feel tired and sluggish because our bodies use water to transport nutrients and oxygen to our cells. When we're dehydrated, those cells don't get the nourishment. They need to stay active and healthy. In addition, our bodies use water to regulate our temperature. So when we're dehydrated, we're more likely to overheat, which can lead to heat exhaustion or even heat stroke. Here are some simple ways to determine your hydration status. 1.1 Self-check questions. Begin by asking yourself these questions. Do you frequently feel thirsty? Or conversely, rarely notice thirst even after hours without a drink? Is your urine pale, straw-colored, or does it tend toward a darker yellow? Are you experiencing dry mouth, cracked lips, or persistent headache? Do you feel lightheaded upon standing, or notice reduced urinary frequency? If you answered yes to any of these, you may be under. Thirst is a late indicator by the time you feel it. You may already be 1 to 2% below your body's ideal water balance. Early recognition is key. 1 point to check your urine. Another way to tell if you're hydrated is to look at your urine. If it's pale, straw-colored, you're probably well hydrated. However, if it's dark or yellow, it could mean that you need to drink more fluids. You should also pay attention to how often you're urinating. If you're only going to the bathroom 4 times a day or less, you may not be getting enough fluids. 1.3 Monitor your weights. Because water makes up a significant portion of our body weight, even a small change in hydration status can affect our overall weight. In general, a 1 to 2% reduction in body weight can indicate dehydration. So if you're feeling thirsty, have dark yellow urine, or have lost 1 to 2% of your body weight, it's time to drink up. Now that you've assessed your hydration status, let's talk about why drinking water is so important. Our bodies need water for everything, from regulating our temperature to transporting nutrients to our cells. When we're dehydrated, even by just a small amount, it can throw off our internal balance and lead to all sorts of problems. That's why it's so important to drink plenty of fluids, especially water, every day. So how much water should you be drinking? The amount of water you need will vary depending on a number of factors, including your overall health, activity, level, and climate. However, a good rule of thumb is to aim for about 8 to 10 glasses of water per day. Let's explore the benefits of maintaining optimal hydration levels. When we're well hydrated, our bodies function at their best. We have more energy, focus, and clarity, and we're less likely to get sick. In addition, staying hydrated can help us maintain a healthy weight, improve our skin and hair, and prevent headaches and other common ailments. I've compiled some practical tips to help you incorporate more water into your daily routine. Set reminders on your phone. Keep a water bottle with you at all times, and make it easy to access throughout the day. Drink water before, during, and after exercise. Add flavor to your water with fruits, vegetables, or herbs. And if you're still thirsty, consider switching to decaffeinated herbal teas or infusing your water with electrolytes for a flavorful, hydrating boost. As we wind up, remember that the benefits of proper hydration extend far beyond quenching your thirst. It's vital for your overall health and well-being. Now you're equipped to assess your hydration status, understand its importance, and take action to maintain optimal levels. So drink up and experience the difference that adequate hydration can make in your life. Thanks for watching. Staying properly hydrated is super important when it comes to maintaining your health and well-being. But how much water should you be drinking? I'm going to answer that question and many others in this episode of the Habits Pharmacy podcast. Hi, I'm the co-founder of a health tech company and the Habits Pharmacy app. Let's get straight into it. There's no one-size-fits-all answer to how much water you should drink, but there are some evidence-based recommendations that can help you determine your personal needs. To make sure you're getting enough water, consider these 3 tips. Tip No. 1. Objective monitoring. This approach involves tracking specific metrics related to your hydration levels to get a more precise assessment of your needs. Here's what you can monitor. First, your body weight. Sudden daily weight loss of over 1 to 2% of your baseline body weight often reflects a fluid loss through sweating or insufficient intake. You can check your body weight daily using a reliable scale and track any significant fluctuations. Second, pay attention to your urine output. Not all dehydrating conditions will show up in your weight, especially early on. So monitoring urine can be a helpful additional signal. The urine should be clear or very light yellow, like lemonade. Dark amber-colored urine can indicate dehydration. And lastly, pay attention during exercise or hot weather. During these times, you'll lose fluids through sweat, so it's essential to replace them. Weigh yourself before and after exercise. Each pound lost during exercise roughly equates to about 500 milliliters of fluid deficit. You can use this information to estimate your fluid loss and adjust your intake accordingly. Tip 2. Evidence-based daily water intake targets. While individual needs can vary based on age, activity level, climate, and health status, several authoritative bodies provide general guidelines. I've put together the most recent data from the U.S. National Academies of Sciences, Engineering, and Medicine. On average, adult men should aim for about 3.7 liters, or 125. How and when you take in fluids can be just as important as the volume you consume. Proper hydration isn't just about downing liters of water. It involves understanding how your body absorbs and utilizes fluids for optimal performance and health. So let's discuss the best times and ways to sip throughout the day. First, spread your intake throughout the day. Start early in the morning. Upon waking, you've just completed several hours without fluids. So it's essential to drink 250 to 500 milliliters of water first thing in the morning to counter overnight fluid losses through breathing, sweating, and urination. The Institute of Medicine recommends this amount for both men and women. However, individual needs may vary based on factors like body size, climate, and activity levels. Once you've had your morning water, it's important to establish a routine to ensure consistent hydration throughout the day. Experts suggest consuming 200 to 300 milliliters of water every 1 to 2 hours. This strategy helps your body maintain a steady hydration level, preventing it from getting too dehydrated. Additionally, it allows your body to absorb fluids gradually, making it more comfortable. Instead of chugging large volumes of water all at once, which can sometimes lead to bloating or discomfort, you can incorporate these smaller water breaks into your daily routine. For instance, drink a glass of water before each meal and a few sips between meetings or tasks. Setting reminders or using a water tracking app can help you stay on track. Enhance absorption. The temperature of your body's fluids is around 37 degrees Celsius or 98.6 degrees Fahrenheit, so it's not surprising that your body tends to absorb room temperature water more quickly than ice-cold water. This is particularly true when you're exercising or engaging in physical activities. When you drink cold water, your body first has to bring the water to room temperature. Before it can absorb it, this additional process takes time and can slightly delay hydration. On the other hand, room temperature water starts its journey through your digestive system right away, providing quicker hydration. However, if you find that drinking room temperature water is unappealing, don't force yourself. The most important thing is to stay hydrated. You can still benefit from drinking cold water. Just be aware that it might take a bit longer for the full hydrating effects to kick in. Another consideration is adding a pinch of electrolyte, such as sodium or potassium, to your water, especially if you're engaging in endurance activities longer than 1 hour. Electrolytes are essential minerals that carry an electric charge and play a crucial role in fluid balance within your body. During prolonged exercise, you lose not only water, but also electrolytes through sweat. This can disrupt your body's fluid balance and affect performance. By adding a small amount of electrolyte powder to your water, you can replenish these lost minerals more effectively and maintain proper hydration. However, for most people, regular tap or bottled water is sufficient for everyday hydration. Optimize around meals and exercise. To optimize your hydration during exercise, follow these guidelines. Drink 500 milliliters of water 2 hours before exercising. This helps ensure you're well hydrated in the time leading up to your workout. During exercise, aim to drink 150 to 250 milliliters every 15 to 20 minutes. This helps replace fluids lost through sweat and keeps you hydrated during physical activity. After exercise, rehydrate by replacing 150% of the fluids you lost. For example, if you lose 1 kilogram or 2.2 pounds during a workout, drink 1.5 liters of water over the next several hours. This aids in recovery and helps your body rehydrate effectively. With meals, sipping water during and between meals can aid digestion. Water assists with enzymatic breakdown and nutrient absorption, helping to move food through your digestive system more efficiently. However, avoid drinking too much water with a meal, as it can dilute gastric juices, potentially leading to discomfort. In conclusion, while the quantity of water we drink is important, The timing and method of consumption are equally crucial for optimal hydration. By following the tips outlined in this video, you can ensure that you're providing your body with the fluids it needs when it needs them, enhancing overall health and well-being. Remember, consistency is key. Make an effort to sip water regularly throughout the day, especially around meal times and during or after exercise. By doing so, you'll support your body's natural processes, boost energy levels, and keep it in top condition. If you found this video helpful, please give it a thumbs up and share it with your family and friends. Also, feel free to drop any questions or comments you have in the section below. Stay healthy, stay hydrated. So is it possible to drink too much water? Well, though it's incredibly rare, it is possible. You see, drinking too much water can actually become dangerous by diluting the sodium in your blood, a condition known as hyponatremia. This can make you feel nauseous, confused, and in severe cases cause seizures. So it's important to drink when you're thirsty, especially during long endurance events. And if you're going to be consuming large volumes of fluids, be sure to include electrolytes. Watch for signs of water intoxication, such as sudden weight gain, persistent headache, or blurred vision. On the flip side, not drinking enough water can lead to dehydration, which can cause you to feel thirsty, have dry mouth, produce less saliva, resulting in bad breath. You may also experience dizziness, fatigue, muscle cramps, and dark yellow urine. When you are adequately hydrated, many wonderful things happen in your body. Here are just a few. Your cardiovascular system will be supported as proper hydration maintains blood volume and pressure, preventing a sudden drop in blood pressure when you stand up too quickly, known as orthostatic hypotension. It reduces the strain on your heart and blood vessels, easing the workload of your cardiac muscles. This is particularly important for older adults or those with heart failure. Your renal function and detoxification processes will be improved. Drinking enough water promotes healthy glomerular filtration, helping your kidneys efficiently remove metabolic wastes and toxins from your blood. This keeps your blood clean and your kidneys working at their best. Additionally, staying hydrated prevents the formation of kidney stones by diluting urinary solutes and helps prevent urinary tract infections by flushing out bacteria. Your cognitive performance and mood will be enhanced. Even mild dehydration, as little as a 1 to 2% loss of body weight, can impair concentration and short-term memory. On the other hand, being well hydrated helps stabilize your mood, as studies have linked underhydration with increased feelings of anxiety and fatigue. Your gastrointestinal health will be supported. Drinking enough water facilitates regular bowel movements by keeping the stool soft and preventing constipation. It also aids in the absorption of nutrients by acting as a solvent for digestive enzymes and the transport of microbes. Finally, proper hydration enables efficient allowing you to sweat effectively during heat exposure or exercise without becoming overheated. This helps prevent heat-related illnesses such as heat exhaustion and heat stroke. In conclusion, staying hydrated is essential for your body to function optimally. By drinking enough water, you support cardiovascular health, renal function, cognitive performance, gastrointestinal health, and thermoregulation. However, it's equally important not to overhydrate, as it can lead to Listen to your body. Drink when you're thirsty, and you'll reap the numerous benefits of proper hydration. Do you struggle with drinking enough water throughout the day? Share your tips with us in the comments below. And if you found this video helpful, be sure to like and share for more health and wellness tips. Today I'm going to teach you how to optimize your hydration. I'm a doctor. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series is created to help answer some of your medical questions and the questions that are commonly asked by patients. If you find this video helpful, please subscribe. So, how much water should you be drinking? There's no one answer fits all. It depends on many factors like your activity level, the climate where you live, and your overall health. But two very important questions you can ask yourself to figure out if you're drinking enough are: have I been drinking enough water today? And am I spacing my intake appropriately? Let's address each one at a time. First, how do you know if you've been drinking enough water today? You may have heard the recommendation to drink 8 glasses of water a day. However, the actual amount varies greatly, depending on many factors. For example, if you're very active or it's hot outside, you'll need more water. In general, men should aim for about 3.7 liters, or 15.5 cups of fluids a day. Women should aim for about 2.7 liters, or 11.5 cups of fluids a day. Remember, these are just general guidelines. You may need more or less depending on your individual needs. A good rule of thumb is to monitor your urine. If it's pale and clear, you're likely well hydrated. If it's dark, yellow, you need more fluids. Second, are you spacing your intake appropriately? It is just as important to space out your fluid intake evenly throughout the day as it is to drink enough in total. Dehydration can sneak up on you even if you're drinking enough overall. To prevent this, try to drink water consistently throughout the day rather than chugging large amounts all at once. For example, you could drink 250 to 500 milliliters upon waking, 200 to 300 every 1 to 2 hours through the day, and then again before, during, and after working out. And finally, another glass an hour before bedtime to avoid waking up at night to use the restroom. Keep in mind that if you live in a hot climate, have a physically demanding job, or are exercising, you'll need to drink more. In conclusion, optimal hydration is a simple yet profoundly impactful pillar of health. By consistently asking yourself these two key questions, you can proactively safeguard your cardiovascular, renal, cognitive, and digestive systems. Just remember, it's not about the quantity of water consumed in a single instance, but rather about the cumulative effect over the course of a day. Stay well hydrated, stay healthy. I hope this video answered some of your questions. If you have other questions or concerns, please contact your doctor. As always, stay safe.